everyone. Good morning. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be keeping good health. Today, we are going to talk about something that affects everyone no matter where you live, that is, fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Fungal infections like Achilles foot or nail fungus might not be the first thing we think about when it comes to our health, but they are important and can cause serious problems if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it and to find out the solution. We'll look at how to stop fungal infections from happening and talk about the latest treatments this month. As we all know, it's all about being aware of fungal infections and how to stay healthy. So it becomes even more important and essential to talk on fungal infections. So let's connect today with our skin expert, Dr. K Chakroborty. Dr. K Chakroborty is live from Sodepur, Amravati, to provide us vital information on advocating for prevention methods to combat fungal infections. Dr. Chakraborty is MD, DVD, MBBS, gold medalist, CLTC School of Tropical Medicine, and also is ex-assistant of Dr. Panja, skin, sex, beauty, leprosy specialist. And currently, Dr. Chakraborty is practicing at Sodepur Skin Clinic, Sodepur, Amravati. A very warm welcome to you, Dr. K Chakraborty.
Good morning.
Good morning, doctor. And today we are going to talk about fungal infections. And as we all know that, it's summers, it's very hot, humid. We all are sweating a lot. And thus the cases of fungal infection also seems to, rise. So first of all, doctor, what are fungal infections and how it affects us badly?
Actually, it's a saprophytic infection. And this hot, humid climate, it's specific for this type of fungal infections. These saprophytes actually live on dead skin and they inflate on and they migrate on normal skin, and then they are increasing in population. Climate and environment plays a major role in fungal infections. Tropical, humid climate where perspiration is maximum, and the skin folds where perspiration is maximum and the skin folds, the infections occur predominantly. Some types of infections occurs on head, that's tinea capitis. Some types of infection occurs on body, that's tinea corporis. And some type of infection occurs on hands, that's tinea manum. Some types of infection, fungal infection, this saprophytic infection occurs in foot, that is tinea pedis. So different types of fungal infections occur in different parts of the body. Moisture and perspiration, they plays a major role in this occurrence of these fungal infections. And our climate is predominantly tropical climate, and these fungal infections are predominant in tropical regions and tropical climate.
Okay, doctor. Doctor, are there specific populations that are more prone to fungal infection?
Hello?
Hello, doctor, are you getting my voice?
Yes.
So I was asking, are there specific population that are more prone to fungal infections?
Yes, there are many specific populations, specific groups, particularly elderly who are diabetic, immunocompromised, who have thyroid problems, infants. They are much. Yes. There are interruptions.
Yes.
So immunocompromised patients, in case of immunocompromised patients, where body immunity is low, these type of infections occur frequently.
Okay. And doctor, we always say prevention is always better than cure. Any way we can prevent it?
We have to maintain personal body hygiene, and this personal body hygiene we can maintain by taking daily bath with soap, preferably twice a day bath is preferable, it's
Okay.
better. And after that we have to soak our body with dry towels, and uh, we should stand for about uh, 2 to 5 minutes. After that we should wear clothes, that is fine. And we should maintain proper hygiene. The nails should be trimmed, uh, the scalp hair should be brushed regularly, should be shampooed twice or thrice a week, and the clothes which we wear on the previous day should be washed properly, and it should be dried in sunlight for about 1 to 2 hours. One point I like to clear that after drying up in the sun for about an hour, it should be kept for another hour, so that the spores, the fungal spores which remain in clothes,
Mhm.
should be dead at least. And proper hygiene, maintenance of proper hygiene should be done to prevent or to avoid this type of fungal infections. And another thing, if we use hotel or other rooms, and the fungal infections occur predominantly from lavatory seats. So the seats should be, we should wash it properly, and after washing the seats we should sit, uh, and for proper disinfection should be done. And if other members of the family affected, they should be treated properly, so that uh, the fungal infection don't spread.
Right. So maintaining personal hygiene goes a long way in preventing fungal infections. Doctor, can you provide guidance on how to recognize early signs or symptoms of fungal infection, how they look like, enabling early intervention and prevention of complications?
Actually, fungal infections first starts from itching. So if there any patient complaining of itching, any part of the body, without self medication, actually patients do self medication. They go to nearby medical shops, medicine shops, and procure topical medicine. And most of the topical medicine they bought are especially steroid ointments. The steroid ointments should not be bought, and that will aggravate in the future the signs and symptoms. And if any patient comes with itching, then we should first diagnose it whether it's a fungal infection or not. We have to diagnose it properly, and then we can treat it. And another thing, uh, when the fungal infections occur in our body in intertriginous areas, in folds, skin folds, in exposed parts of the area or in the covered area, they look like a ring with central clearing, and there is a margin. These margins are erythematous and raised. And actually, by proper clinical examination, we can diagnose this type of fungal infections, and then we can treat it.
Okay. Okay, doctor. Doctor, as you said, and it's really very important to understand that why it is important to go to the doctor at the first place in case there is any infection, be it fungal or any other infection or allergy on our skin, and not to go for home remedies or over the counter medication, etc. But the fact remains, as you also said, many of us will actually go to the chemist shop first and we'll start using the topical creams, and because they contain steroids and all, and initially they work well, and we think that we have find a solution. Only when the condition keeps worsening we realizes that it's not the right thing, and then we goes and land up in front of a doctor. Now my question to you, Dr. Chakrabarty, is that, for example, there is a person who is having itching, and he approaches you at the very first place, and then there is another person who goes through these topical creams, over the counter medication, self medication, etc., and then comes to you. What is the difference in their treatment duration? How difficult it becomes to treat the one who has done self medication?
Actually, maximum patients who go for self medication, they use topical creams. They don't use oral tablets. So the topical creams, actually all topical creams which are served by the medicine shops without prescription, containing steroids, and these steroids actually at first they subside the fungal infection, but after that the fungal infection relapse, and this fungal infection aggravate. And also the steroid ointment which used for prolonged time cause skin thinning, skin atrophy, and stry. And these types of things are very difficult to treat. So my advice is, don't go for self medication. Don't do it. It's very dangerous. If any doubt for fungal infection or anything occurs in body, please go for a qualified dermatologist to diagnose it first and then to treat it.
Right. So it becomes very important to go to the doctor first, go to a qualified dermatologist first, and get it diagnosed and treated. Now, when a person comes to you with fungal infection, or maybe the person is not aware whether it's fungal infection or anything else, what is the right way to diagnose? Do you recommend some test, or just by clinical or physical investigation you can make out that this is fungal infection?
Actually, fungal infections we diagnose by actually clinical examination.
Okay.
As I previously told, that the fungal infections are basically, they are ring shaped, and there is a clear margin, no, central clearing with elevated margin, and margins are erythematous, and itching is on sides and also on the central portion which is clear. And by clinical examination, actually we diagnose 98% cases we diagnose. In case of some head infections, scalp infections, we have to, in especially in case of infants, we have to test wood slamp with the wood slamp examination, which uh, have fluorescence test, and this type of fluorescence test we can diagnose what type of fungal infections occur. And another thing, where the fungal infections are very difficult to be diagnosed, then in that cases we have to use fungal scraping with potassium hydroxide KOH media. That is fungal scraping. We can diagnose typically which type of fungus is there. But one thing is that this type of culture occurs. It takes about a few weeks to be grown. In media takes few seconds, few weeks to diagnose the specific organism. So clinical examination is a good idea.
Okay, fair enough. And doctor, what are the treatment options available?
Treatment options are there. Many treatment options are there, but actually, first of all, we have to diagnose which type of fungal infection is there, whether it's a localized infection or generalized infection. If the infection is localized, then we have to treat it topically. And if the infection is systemic, Then with the topical treatment, we have to do oral treatment, both. And there are many drugs for topically, uh, imidazole, clotrimazole, miconazole. There are many drugs, and we have to use the drugs with which will be suited properly by clinical examination. And oral drugs are many: griseofulvin, uh, then itraconazole, fluconazole. But the drug itraconazole is the maximum suitable drug which should be used first. And if any resistance occurs in case of itraconazole, then we have to think of over other systemic drugs. And the drug, another thing, the drug dose should be proper and should be of the duration which we suggest. A patient, a self-medicated patient or other patients, they use the drugs uh, with their intention is so that the drug should be used minimum, so they don't take full dose. And if they don't take full dose, then the fungus will not be cured properly.
Hmm. Now, doctor, we have also seen recurrence in case of fungal infections, and you also said minutes ago that when you do self-medication, etc., recurrence happens. So it's just the self-medication, or there are other causes also for the recurrence of fungal infection.
Fungal infections, recurrence of fungal infections occurs mainly due to self medication. And if steroid ointments are used,
Hmm.
then this recurrence will be maximum. Another thing which I just told, that proper doses of the oral medicine and the topical medicine should be maintained. If you don't maintain proper dose, then recurrence will be there. And these recurrent fungal infections are very difficult to be treated. And in that case, we have to treat it differently. Maximum patients don't take oral medicines for proper time. They actually take it for 10 days, 15 days, and then when it subsides, they leave it. They don't take oral medicines. Then when it recurs, I just told, it's very difficult to be treated.
You're right.
And
So,
another thing,
yes, doctor.
sorry, another thing, that there are some rules. Uh, Oral medicines should be used properly for 4 weeks or 6 weeks according to the cases. And for fungal infection, fungal nail or infections or other fingernail or toenail, it should be used for 6 months or 12 months according to the case. And the dose should be maintained properly. And topical case, when topical treatment that topical medicines are used, they should be used after submission of the lesions, of regression of the lesions, for 2 weeks at least. There is a rule: two and two. Two and two means 2 inch beyond the margin. The margin, the erased margin of the fungal lesions, we should apply the ointment 2 inch surrounding. And also it should be used 2 weeks after submission, after regression. This rule of 2 and 2 should be maintained in case of fungal infections, obviously.
You're right. So the bottom line is A, in case there is fungal infection, we need to go to a qualified dermat at the very first place. B, we need to follow the advice, the prescription as given by the doctor. So don't self-medicate and don't stop medication just by yourself without informing your doctor. Follow your doctor. That's really important. Now, doctor, fungal infection is something that spreads from one to another, and in case there is a member in a family who is infected or is affected by fungal infection, uh, what should be the protocol the whole family should follow to not catch it?
All the family members should be treated simultaneously with proper doses of medicine, and they should maintain personal hygiene. All body uh, body clothes, personal clothes should be uh, washed, should be dried properly, and the oral medicines with proper dose should be taken. The topical medicines should be taken properly, and that's the way that we can control the spreading of fungal infections. Actually, fungal infections, the open lesions means the lesions which are on the open parts of the body, they spread very quick. So we should uh, do the above things to prevent the,
Right. There are some of our viewers who have asked questions. I'll take them one by one. Um, Ankit is here. So, is it true that pets can spread fungal infections to humans?
yes, they can spread. If there is fungal infection in the pets, then they can spread. They can spread, but actually the measure is to treat the pets with the veterinary doctors properly, and to avoid handling the pets too often so that they can't spread.
Hmm.
We have to isolate the pets, treat it properly so that the fungal infection which is in their body should be treated properly and should be eradicated.
Okay. There is one more question by Rahul. Can fungal infection leads to chronic sinus problem?
If fungal infections occur inside the body, in the lungs, it can occur. Deep fungus, we treat it, we call it. And in case deep fungal infection in the lungs or in the respiratory tract can lead to, or it can lead to sinus problems. Yes.
As we were talking about how people go for home remedies and over-the-counter medication, there is a question by one of our viewer: can fungal infection be cured by applying lemon juice?
No. By applying lemon juice, no, there is no way. No, no, no.
Right. So the
It is
right
not a medication. It's
way
not a
is to
medication.
go and consult a doctor and not going for these home
Yes,
remedies.
obviously, always consult a qualified dermatologist.
Hmm.
Always.
Okay. And doctor, there is, you also mentioned about scalp fungal infection and fungal infection on nails.
Hello.
And hello, are you getting my voice, doctor? Hello.
Pardon. One more time.
Doctor, I was asking, you also mentioned about fungal infection on scalp and fungal infection on nails. Would you like to shed some more light over that?
Fungal infection on the scalp. Um, First of all, we have to diagnose it,
Hmm.
whether it's a fungal infection or any infection. If any doubt, we have to, previously I told, we have to do wood lamp examination, and by that what type of fungus is there we can diagnose, and also by fungal scraping. Then we have to treat it properly with the proper antifungal shampoo, antifungal lotion. Cream is not proper for hairy regions, and it will not spread. So antifungal lotion and oral antifungals should be used. And for for fingernails or toenails, if fungal infections are there, then we have to treat it properly. First of all, we have to diagnose it, and then this treatment is pretty longer. Sometimes for fingernails, we have to use medicine for 6 months, and for toenails, it may be used for 12 months.
Hmm.
Oral
Right.
medication, topical medication we use for nail infections, but topical medications are basically it's not of much use. Actually, oral medications are the best for this, and it's a long-term treatment and should be proper dose should be. I told previously, it should be the proper dosing, proper dose for proper time. Then they can be eradicated. Half dose, half time, minimum dose, they will not treat it properly.
And Dr. Chakraborty, before we sum up the whole session, any take-home message for our viewers? Doctor, before we sum up, what would you like to tell to our viewers?
Don't, my special.
I think we have doctor is getting back to us. Yes, Dr. Chakraborty. Yeah.
Hello.
Yes, you're concluding.
My special. Good evening. My special message is: don't be afraid.
Yes.
My special message is: don't be afraid of fungal infections. Don't be afraid. Treat it properly. First of all, go to a qualified doctor. It should be treated properly. Personal hygiene, maintain personal hygiene properly, and take the proper doses of medicine as prescribed by doctor. And if family members, all the family members are affected, as fungal infection is a contagious disease, and then treat all the family members properly, and thus maintaining that we can eradicate fungal infection in very good way.
Right. Thank you so very much, Dr. K Chakraborty, for your valuable time. And it has been a very informative session for our viewers. Thank you once again, Doctor.
Thank you.
And viewers, thank you for your participation in today's session, and stay connected to our channel. Do not forget to subscribe our channel, Radiance with You. Thank you. Have a good day ahead. Goodbye.